Many child psychiatrists believe it is impossible to diagnose bipolar in a 4-year-old. There remains widespread confusion in the field. In the Manual for Diagnosing Mental Illness, the DSM, adult bipolar is clearly defined by recurring episodes of mania and depression. The manual says nothing about how to diagnose bipolar in kids, but Dr. Joseph Biederman and his colleagues argue that rapid mood swings, tantrums, and what's called explosive irritability are the key symptoms of childhood bipolar.
The criteria for mood disorder in children include something called irritability, but the symptom like irritability occurs in something like 26 different diagnoses. So it probably means very different things in different contexts and to different people.
I think a lot of the controversy has centered around the fact that our kids who have big temper tantrums, a 9-year-old with a big temper tantrum who can't control himself, this happens a few times a week. Is that coming from bipolar disorder? All right, any other thing you want to talk to me about? Or
Dr. Kiki Chang, a researcher at Stanford University, defends Biederman's criteria.
Okay, so wait, the new youth group, tell me about that. When you take irritability to the extent that some of these children exhibit it, and then when you add the other manic symptoms in there, decreased need for sleep, increased goal-directed activity, racing thoughts, all those things together, you're at least somewhere on the spectrum.
But critics say all the debate and confusion has led to overdiagnosis. And many children with bipolar are being treated by pediatricians and family doctors who are less familiar with the diagnosis.
And when you're a pediatrician and you're seeing a child every 15 minutes, it's very tempting to go ahead and add one of the atypical antipsychotics when you've got a kid who's oppositional and aggressive. So in a sense, the doctors and the patients and their parents are forced into this Faustian bargain where everybody would like to take the time to think through the problem, but that kind of thoughtful, careful evaluation simply doesn't exist in most pediatrician or family doctor's office.
3 years ago, Jacob Solomon's family moved from Los Angeles to the mountains above Denver.
Tell me when you want to set this up. You want to do that now?
Jacob is now 16.
Okay, we'll open these first.
He remains on a potent mix of medicines, and he still rolls his head.
Risperdal is for anxiety and moods. We've tried different combinations and found that this seems to be the best combination for him right now. Every time he has a growth spurt, it changes. And which one is this?
So I haven't seen you in about a month, right?
I don't know. I think so.
So how are you doing with the nervousness right now?
I'm doing good.
You're okay?
I mean, I have a lot of things on my mind, like what am I going to do when I go back to school? What classes am I going to have?
Dr. Marianne Wambolt is chief of psychiatry at Denver Children's Hospital.
Sophomore.
So that's better?
She says Jacob is one of a growing number of kids who come to her with a bipolar diagnosis and multiple prescriptions.
What are you doing differently? Jake came to me on about 8 or 9 medications, some of which I had never heard about being used for the purported purposes that they were being used for. So when I first saw him, my initial take was there's too much over-pathologizing of symptoms and over-calling them symptoms that need a medication rather than thinking about other ways to deal with the symptoms. And the family was very open to that, and they really wanted to get him off of as many medications as they could. So, Jake, how could we measure your tics?
Right now, they're about maybe 4.
What does that mean? 4 up?
1 through 10. One's like the best it could be. 10's the worst it could be. Right now it's about a 4. It's getting better. 20 times a minute. Sometimes
tics are a side effect of stimulants. Often when you stop the stimulants, the tics go away. In Jake's case, they didn't go away. It's a tricky thing because we're dealing with developing minds and brains. Medications have a whole different impact in the young developing child than they do in an adult, and we don't understand that impact very well. That's where we're still in the dark ages.
One of the few places that specializes in childhood bipolar is at the University of Pittsburgh Medical Center. The doctors here say that many of the kids referred to the clinic come in misdiagnosed with a slew of labels.
Maybe new cases then, or new referrals, Tim?
Yeah, two. One is a 9-year-old. She's going into the 4th grade and has a past diagnosis of bipolar 2, ADHD, ODD, OCD.
They say it can take months or even years to untangle a case and decide whether a kid is bipolar or not.
Irritability, increased sleep tearfulness, some anhedonia.
One thing that's complicated is bipolar disorder is probably not a single unitary disorder. It's probably a syndrome that's a collection of things that are related and can overlap with other child psychiatric illnesses, including ADHD, including depression.
She said these episodes can last like 1 to 2 days.
There is a risk of this being something that is a label that's given inappropriately. So we have to be very careful and cautious about diagnosing a child with this illness.
Right now, but she has verbalized some suicidal ideations.
Okay, she sounds like a good kid for us to see. We're barely getting started at figuring out what might be wrong in these kids' brains. You know, the brain is extremely complicated, and it's going to take us a long time to figure out these problems.